We want to welcome everyone back for our first panel discussion of the NPFE-LAN Summit. Next slide, Matt. Let's take a look at today's agenda. Our moderators are Dr. Shalyn Quinn and Lisa Reeves. Dr. Quinn has been with CMS since 2009, first working in the Division of Quality Improvement as a contracting officer's representative from the Quality Improvement Organization contracts. She then became the Dallas Division of Quality Improvement Associate Regional Administrator. Since joining the QIIG, Shalyn has served as the Acting Division Director for the newly formed Division of Kidney Health and has most enjoyed the close focus on patient and families in the ESRD network program. Shalyn received her PhD in epidemiology and Master's of Public Health degree from the University of Texas Health Science Center. Joining Dr. Quinn as a panelist is Lisa Reeves. Lisa joined CMS in 2009 as a nurse consultant for the Division of Survey and Certification and transitioned to the Division of Quality Improvement in 2013 as a quality improvement specialist working with the ESRD network program. Currently, she is the CMS subject matter expert for 3 ESRD programmatic areas: kidney transplant, home modality, and bloodstream infections in the Division of Kidney Health. Ms. Reeves is the data lead for the Division of Kidney Health, working closely with the ESRD National Coordinating Center. And then we also have on our panel, our patient panels include Kim Pratt, Patrick G., Donna Davis, and Vincent Fontanetta. Kim Pratt is a kidney transplant recipient from Rhode Island. She was diagnosed with kidney failure in July of 2014. She was on dialysis for 5 years. In June of 2019, she received a new kidney from an altruistic donor. Kim is eager to give back to the kidney community. She is a patient subject matter expert with the ESRD NCC and a member of the ESRD Network 1 Patient Advisory Committee. Patrick G. is a kidney transplant recipient from Virginia. He received a new kidney in April of 2017. He waited 47 days until his kidney began to function. Patrick advocates for quality care for all patients with his extensive community activities. Donna Davis is a retired high school and college literature teacher. She has been on in-center hemodialysis for 14 years. She has been a patient subject matter expert with the ESRD NCC for 2 years, and she is proud of the resources she's helped produce with the NPFE-LAN. And then lastly, Vincent Fontanetta is an in-center hemodialysis patient from Ohio. He was diagnosed with renal failure as a child. Vincent is an active member of the kidney community, both locally and nationally. He volunteers as a patient subject matter expert with the ESRD network of the Ohio River Valley, Network 9, and he also serves as a patient subject matter expert with the ESRD NCC. Please welcome everyone to the webinar, and I will turn the call over to Dr. Quinn.
Hi, thanks everyone. Welcome. I'm so excited to be a part of this discussion and frankly, the whole entire conference. This is one of the highlights of my year. So we want to thank the panel again for sharing all of their thoughts on coping during the COVID-19 pandemic. We do have the 4 panelists that were just introduced. We're excited to talk to them. We're excited for them to share their personal experiences of coping during the panel. We've saved time in the agenda at the end for your questions, so please be sure to save your questions for the end as well. So we're just going to go ahead and get it kicked off, and I will turn it over to Lisa for the first question.
Because I always enjoy hearing from our patients. So our first question for our panelist is, Can we talk a little bit about some of the fears that you might have faced during the pandemic? Kim, Patrick, would one of y'all like to kick us off?
Uh, sure, I'll start. Greetings from Rhode Island. I'm Kim Pratt. I think that a lot of us had the similar fears. Me as a transplanted patient, I was afraid to obviously catch COVID and damage my kidney in some way, or become very ill. That's I think most of us feel that way. I do live in an apartment complex, so I was concerned about coming in contact with people by coming in and out of my apartment. And we use a laundry room for the building, and there's a dozen apartments for one laundry room. So I was concerned about that. I was avoiding the gym. So my fear is, gaining weight during this time. I feel that, there's, everyone's having a little emotional worries, being kind of isolating themselves more. So I feel that those are fears, and kind of in a joking way, the way it is now, it's hard to find a public restroom nowadays. There's a fear of leaving your house and there's no restrooms. That's a little on the funny side, but I'd say really mainly is getting ill is the main fear during this pandemic.
Thank you for that, Kim.
Mm-hmm.
Would one of the other panelists like to speak to that? Donna, Vince, Patrick?
Yes, this is Patrick. Greetings from Virginia. Some of the fears that I initially had at first was the limited resources that was afforded to kidney patients, as well as those with at-risk medical factors. Also, limited access to medical care. I know when I was coming down with the symptoms of COVID, it literally took me 4 attempts just to get tested. And lastly, a big fear that kind of had a major impact on my health was the uncertainty around the treatment options for kidney patients. I know at the particular time when I tested positive for COVID in March of last year, the only medication that was given to transplant recipients was hydroxychloroquine. And that was based off of studies in Seattle, Washington, as well as New York. And when I was prescribed the medication, the side effects took a toll, and I ended up becoming a long hauler, not really finding some sense of normalcy until January the 4th of this year. So those 3 things were my biggest fears.
Thank you for that, Patrick. Donna, Vince, since y'all are in-center dialysis patients, do you have a different perspective?
I know for myself, I was worried about if somebody got it in the clinic, how quickly it was going to spread. You've got all these people in basically such a small area, and yeah, we all had masks on and stuff, and they try to do the best they can, but you never know if that's really going to work or not. And I was concerned for quite some time as to how that might end up playing out. But everything's been fine, and nobody at our clinic so far has been diagnosed with it at all. We've been really lucky. The other fear I've had that, actually was for other members of my family, is I thought a lot about, is like my parents they live in Illinois, and I thought about if they got it, well, I would have no way of being able to see them or communicate with them. And that is still actually a concern of mine. So yeah, there's definitely things that are still weighing on me now, and I'm still coping with.
Thank you. I'm sure a lot of us have family members that cause concern, so that's something many of us can identify with. Thank you for that. Vince, would you like to kind of close us out on this subject?
Well, I wasn't sure if Donna had anything else she wanted to add to it or not.
Oh, I'm sorry. Donna? Donna, you may be on mute. I can't hear you.
Okay, am I on unmuted now?
There you are.
Okay, I was going to say I agree with him. Being in center, it was scary at first, but my center did an excellent job in allaying our fears, and almost every patient was compliant with wearing their mask. There's always that one that thinks they need to take the mask off when they sneeze, but I actually felt safer in my dialysis center than I did in a lot of other places, and actually safer there than in some of my doctor's offices. So that fear was really helped by the people at my center. They stepped up and helped me with that fear.
All right, great. Is there any other comments, anything y'all want to say before we move on to the next question? All right, Shalyn, I'll toss it back to you for the next question.
So you all talked a lot about the uncertainty and your fears just now. And Donna, you said, you know, that your center helped you to get over some of those fears. So that's kind of where we're going with this question. So can you give us an example of a stressful situation that you've been in and kind of talk us through how you got through it?
Well, for me, in December of 2019, I had extensive foot surgery. So I was already confined to bed from December, and I just got a cast on in March. I was free for a week, and then COVID hit. And I thought my little emotional heart was going to just explode because I was ready to get out of the house. And I mean, I still couldn't walk, but do some things. And that was very, very stressful for me. And in that situation, it was really my family. My daughter came down for a vacation and then got stuck here, got quarantined here, and was able to work from here. And then my husband had to work from home. So having my family with me really helped me with that. They took me out in the sidewalk a little bit just so I could get out of the house. And I didn't think it would be that stressful, but after having already been on quarantine, I mean, stuck in the house and on antibiotics for a long time, I was just like, are you kidding me? This can't be real. But, you know, it's amazing how the support of your family can really push you through those stressful situations. They let me whine and whinge about it as much as I wanted and just said, Mom, suck it up. You know, we're all in the same situation. And that helped me kind of get over that stress.
Right. Thanks, Donna. Anyone else want to talk about a stressful situation and how you got through it?
While this was going on, I found out that my brother, my sister-in-law, and my niece all were diagnosed with COVID. And again, had really very little communication with them after the fact. And that was really stressful. It was real scary. For a couple of weeks there, we didn't really know much about what was going on with them. And plus, prior to that, my brother had actually went and visited my mom and dad, not knowing he had it. And we got lucky, mom and dad didn't get it, but I had 3 members of my family all at the same time get diagnosed with it. And that's, oh boy, it was rough. It was rough at first. Everybody's fine. Everybody came out of it all right, but that was more stress than I really wanted to have to deal with at one point.
How did you manage to cope with that stress?
I spent a lot of time. I have my wife talking with her and with the social worker at dialysis, and just being able to communicate with my mom and dad and my wife here and other people, and talking to, I have a friend that's a doctor, and he was kind of giving me updates on what was going on with them, and that was kind of cool too. So those were the ways I coped, is just being able to communicate with the people that are important to you in your life.
Yeah, that makes sense. Thanks.
I had
Patrick?
I'd like to say something, if you don't mind. I don't know if you could see me on the video. Are you able to see me?
Yes, we can see you.
I can see.
You can? Okay. Well, one thing that was a little concerning to me was 2 of my children live with me, and one is my son, who did come down with COVID, and he did have symptoms. And that alone was scary, because I am immune suppressed. We tried our hardest to make it so that we wouldn't, myself and my daughter wouldn't come down with it, because one of the things was I was scheduled for a hysterectomy, and my daughter was scheduled for a tonsillectomy, not that far away from when he first caught it. So a few weeks before, we were scheduled for these, surgeries. So I was concerned about that. In order to plan for surgeries, alone, that alone is scary. And also being in a hospital and hoping you don't catch anything, even just going to your surgery. So luckily, knock on wood, we both tested negative for COVID, for our surgeries. So those did go well. Everything went well. I had a 4-hour surgery, and everything went well. I didn't get any infections or didn't catch anything. And I was just very grateful. And my daughter too was able to get her tonsillectomy. But with our apartment we live in, it's not that large. So I really try to, disinfect, and constantly we had a specific routine we did just to keep tremendous distance between ourselves and my son. Luckily, he did get better, and we did not catch it, and I'm just so thankful for that.
Patrick, before we get to you, let me just say really quick, this is a really interactive session. I know we're holding questions, but we would love to hear in the chat from our audience too, to see, what were your stressful situations? What were your coping mechanisms as well? So let's all try to learn from each other right now. So Patrick, did you have anything to add? A stressful situation and how you got through it?
I've dealt with a lot of different stressful situations, but probably the most impactful one was having to deal with my wife being hospitalized for 6 days with COVID, because both of us kind of took ill at the same time. And as she was getting out of the hospital, I got my test results stating that I was negative. So trying to physically distance in the same home for 3 weeks was really challenging, especially when we used to flip a coin every morning just to see which one of us was healthy enough to care for the other person. But we really got through it through prayer, meditation, and just kind of being selfless, not worried about ourselves, but kind of worried about each other, is what kind of got me still being here right now. So that was it.
A lot of commonalities about leaning on family, friends. So community is important. All right, I'm going to go ahead and turn it over back to Lisa for our next question.
All right. You know, I know a lot of people turn to television news or social media for their information about the pandemic. What role, if any, did that play into your stress level? And as with Shallon, we encourage people listening to use the chat to answer this question.
I'd like to say that for myself, I don't really watch or have anything to do with most mainstream media, just because I don't find a lot of it to be very accurate and or positive in a lot of ways. It seems like the media tries to scare us more than help the situations. I felt that in this case, as soon as it started to get to the point where it was obviously becoming a very serious situation, I went to sources that I could talk to in person, meaning doctors and nurses that I knew, who I felt at least the general information they could give me, it was trustworthy. I really think that in this case, the media and social media actually made the situation worse than it they could have done so much better than they did in helping the public, in helping the CDC and the World Health Organization make things better. I feel that they dropped the ball so bad, because it's more about sensationalism and scaring rather than helping. That's my opinion on that. I mean, I would rather go to sources I trust and that I know one-on-one I can talk to. Social media and the media itself, I just don't.
Thank you for that, Vince. So your way of coping was to either not listen to what the media was saying or to source out more authoritative people that you could listen to and trust. Is that what I'm hearing?
Yeah, absolutely. I chose to go and seek out the information on my own rather than trust in what was being put on the TV and on social media and stuff. I went to doctors, I went to nurses that were in the front lines with this stuff and who had, I believe, better information.
Thank you. I appreciate that. Kim, do you have a different view that you'd like to share with us?
Okay, and that's regarding what we saw on the social media and television, correct? That's what we're discussing. Yes, I found it, it was overwhelming. I'd say that's a good word. It was constant because there was politics involved too, and it just was a constant overwhelming situation of information. But I chose to extract do all the precautions I felt were advised, and I also did the same as listen to educated people that I knew were going to give me the answers that I needed. My close doctors to me, my transplant team, my nephrologist, those are people that I did seek out. I had a situation. My mother lives in Florida. There was a piece on the Today Show at one point where they showed a place called Seed to Table. It was like a little grocery store, but there's upstairs they have more interacting people I don't know if there's music, but it just so happens it's across the street from where my mother lives in Florida. And I know that the reason why they were featured on the Today Show is because everyone, the majority of the employees or non-maskers, and the patrons are mainly non-maskers. They videoed everyone not wearing a mask that you could see in the clip, and it started a conversation between my mother and I, because I said, I know you go there, Mom, all the time. You're 74. I didn't realize you were going there with no mask all the time. I didn't even realize that. And this is, through social media. This is through the news, the television, that you see. And she said, well, I wear it other places, but this concerned me because she wants to visit me in the spring, and I am immune suppressed. So it was that was one situation I dealt with seeing that, and that was on TV. Finding out my mother's not wearing a mask and going shopping.
Thank you for that, because it allowed the opportunity for you to open a discussion about it. So that's wonderful. I would like to ask the panelists, have y'all used the NCC website or any of the tools that have been developed for patients by the NPFE to educate yourself or to educate others?
I do a newsletter for my dialysis facility, and as soon as I was able to get the COVID information from you guys, attached it to the newsletter so I know that everybody in our facility got that information. And then we also posted it on the bulletin board that I keep, because the information's good, it's relevant to that population. They don't have to worry about what everybody else is doing. They need to know what they need to do for COVID. So I find the information most helpful. And it also sometimes helps me. Unfortunately, I'm from Florida, Kim, and I know a lot of anti-masker people. And, I tell them I'm going to wear the mask until my doctor tells me not to. If you don't want to wear one, fine, but don't get near me. I mean, there's no changing their minds at this point. But I also have information. I can say, look, here's the information. This is true. It's a real thing. And it's funny when somebody has somebody in their family get COVID, all of a sudden they're about the mask and the cleaning. So I find the information excellent. I go on there all the time and get information and send it out to people. I'm the kidney lady in the neighborhood and at my church and with friends, and they say, well, I have a question about, this or that kidney thing. I send them right to the website. I said, you're going to find all the information you need to know there. And it's going to be reliable, and it's not going to be anything that you have to worry about.
That's wonderful. Thank y'all so much for that. It's important to know where you can get that reliable information. So I'll toss it back to Shallon for the next question.
Right. So you all talked about how you coped with, really stressful situations during all of this, but I really want to know what you've relied on overall to get you through the last year, through the pandemic.
May I go again, since I'm on a roll?
Please.
For me, it was my faith. For me, it's my faith. I could not have lived through this whole journey with kidney failure if it had not been my faith. It always plays a role in my life. And when COVID came around, a verse came to my mind. I wrote it down so I wouldn't misquote. For God hath not given us the spirit of fear, but of power and of love and of a sound mind. And just knowing that, it took away my fear. And then I looked at where it said sound mind, and that told me that I needed to find the best, most reliable information. I feel God has put me here for a purpose, but I also feel that he's given me a good mind, and I'm not going to waste that on silly stuff. I'm going to take that mind, that sound mind, look up the information, and that helped me a lot. Just remembering, no fear, but use your mind, Donna. Use the common sense God has given you to get through this difficult time. And that has really been a help to me. That, and then my church, all the time I was up with my foot, our church live streams. So I was able to still go to church on the computer, and they continued that after the church was shut down for COVID. And then my church community, we've come together and have made it a priority to send out cards and letters to people that we know, like widows or widowers, elderly people, just cards and letters of encouragement during this time saying, don't be afraid, we're here to help you. And I think having a faith-based community, whether you're Christian, Muslim, Jewish, whatever, I think is just a wonderful, wonderful resource to keep the fear away and to keep the stress down.
Great, Donna. Anyone else want to jump in?
Yeah, I agree with Donna. My faith has really kind of prepared me and kind of kept me during this experience. I know there was a time where I kind of shut all my work and advocacy down for about 6 weeks, just so I could rest in the spirit of the Lord, just to kind of get my mind straight, to just kind of find out exactly what direction that he was leading me in. And even right now, even as bad as COVID has been, it has allowed me to take my ministry of advocacy to the next level. So even now, somebody last year jokingly said, with everything that I've gone through, that I was like the poster child for kidney disease and COVID. So that allowed me to be like one of 2 patient representatives from the United States to actually sit on a continual work group with the World Health Organization. So it allowed me to be able to get information on COVID therapies, to be able to go into underserved and undervalued communities where they don't have these resources. So I'm allowed to share science with faith, and that opens the door to salvation. So even now, with my transplant hospital, I'm allowed to do chaplaincy services down there, and there's still a lot of kidney patients being impacted with COVID, being admitted to the COVID ICU and stuff like that, and they need help, they need hope. So even in the midst of our afflictions, it's not about us, but it's what we can do to kind of lift other folks up until we kind of find what it is that we consider our sense of normalcy until this thing ends. Because COVID was just one pandemic. When you looked at even what's been said on this panel about politics, you see the political ramification around COVID, even to the point that, when you look at people of color, indigenous populations that have been impacted with lack of access to medical care or even treatment, or even access to the vaccine, is still very prevalent right now. So there was a number of pandemics within a pandemic that we had to deal with, and it's still going on. But the best way that folks can really hear this, if they see your affliction and they see that in the midst of your suffering, you're trying to render aid, I mean, it just makes a world of difference.
Thank you both so much. I think at this point, I'll go ahead and turn it back over to Lisa for our last question.
Thank you, Shallon. So what advice would you give to others who are struggling because of how COVID has impacted their lives? I don't know who would like to start. Kim, Patrick, Donna?
I'll go ahead. For me, I would say, you know, you always have to go to a higher source just to find that peace. I would also say to stay away from the television, keep it off as much as possible, and find trusted resources and allies such as the NCC website, the American Society of Nephrology, the American Society of Transplantation, local kidney organizations, national kidney organizations. Just try to not allow what's being said publicly to diminish any type of hope that or optimism that you will have. You know, we are a resilient nation, and even though you know, just like it's been stated, the ball has been dropped, but now that it's been picked back up and medical innovations are out here right now, I think we will be able to overcome this. So I would just say, to kind of surmise this, just limit the amount of things that's coming into your ear, and only just make sure that you have trusted resources that you can depend on.
Thank you, Patrick. Oh, I'm sorry.
Practical advice. You know, having been stuck inside for months and months and months, one of the things that's been a security blanket for me is making myself a little schedule. You know, even when I was confined to bed, I would do certain things, certain times. I decided I'm going to relearn Spanish because I live in Florida. It's useful, but I'm going to learn Welsh of all languages because it's like a big word puzzle. It's much more fun than doing crosswords. But I made myself a little schedule and I would keep to it. I would make sure that I got up and got out of my pajamas, you know, have my prayer time, have my study time. I stayed away from the TV as much as possible, other than watching maybe movies. I'm a big reader, but I decided to mindfully choose books that were going to be something that's going to be encouraging to me. But I had a little schedule that every day, I mean, I still follow it because I'm still basically stuck inside. I can't drive yet. You know, but if you have that, it kind of provides you a little security blanket. If you know, okay, Mondays, that's my day that I write letters. You know, Tuesdays, that's laundry day, even though that's not fun. But I think that really, as a teacher, the scheduling just really gives people a sense of security. And you don't let yourself get drawn into. If you start watching the news, next thing you know, you're there for 4 hours and all you've done is upset yourself. So I really find having a schedule like that, or, you know, deciding to take up a new hobby. I'm not a crafty person, or I'd be knitting or crocheting or something like that. I journal, but something like that I think is a good practical way to keep your mind off what's going on and on something more positive.
Yeah.
Thank you, Donna. Kim, Vincent, do y'all have anything to add?
Family. Your family is who you can turn to at this time, and who you can look to help you get through these things. Friends, the people that are closest to you. That's who I turn to. That's who's been there for me and who I'm there for. And this also includes, actually, I include, as far as family goes, is the people at dialysis. Because I mean, you're in center for so long, and you've been with these people for so long, they become family. They become people you can turn to and people you can talk to. And I've actually, had quite a few conversations with other dialysis patients, and because of the information I've been able to get, I've actually been able to help them, because they're not people that usually will turn to social media or even have any access to it to the point where it matters for them. Yeah, I think that for myself, at least, that my wife and my family in Illinois, and my family in in dialysis clinic, they're the ones that have helped me get through this, and who I think is good for, that's who people should turn to, is those that are closest to them, that are dealing with it with them at the same time. We crave contact, we crave social socialization, and something like this that actually wants us to stop that. You have to find more creative ways of keeping those connections going, and that goes a long way in helping you cope and deal with the things that are going on right now. It may be some time before this gets to the point where we can be in a room together without a mask on, or if that'll ever be, I don't know. But those relationships, you got to maintain them, and you got to strengthen them, and be there for each other.
Most definitely. Thank you for that, Vince. Kim, do you have anything you want to add before we move on and ask for questions?
Sure, I'll just quickly say I agree with all the points made by the other panelists. Everything, faith, family. I like what Donna said, being organized, because there's, we have to adapt to this new situation. We have to adapt and be positive, and don't give up hope. And communicate your needs, and research what programs are available to assist, with those needs. Fresh air, sunshine, and exercise always helps everything. I just wrote down something, is just adapting even the small things and the big things. Let's just say if there are a lot of patients that utilize food banks, let's say, and in this, even just a small area of life there in that department, you can't go in as a renal patient. It used to be where you could go inside and select what things that you would use. But nowadays you can't go inside, so they just bag up random items and then you just pick it up. But with a renal patient, a lot of items in a food bank are not renal friendly. So you really end up picking up a lot of food that you can't use. So when I say adapt, you contact that food bank and ask, and give them ahead of time what things you can use, and just ask if they can, include those things and exclude all the things that you can't eat that's not on the renal diet. Just a little areas everywhere, just to adapt, like we did when, a lot of us learned we had the kidney failure. Some of us knew it ahead of time. Some of us just found ourselves thrown in the world of kidney failure and kidney disease, and we had to find within ourselves a strength to adapt our lives at that point, way before COVID or pandemic. We found a strength within ourselves to adapt and accept those things, and we adapted our lives to include treatments and ways to deal with our kidney failure. So once again, we're faced with having to adapt again.
Said something, Kim. You gave me a great idea. My daughter is also a teacher, and she works with service clubs at her school. What a good idea for, instead of just having a food bank day, that like March is kidney month. If they were to collect kidney friendly foods.
Yes, kidney friendly.
to take to food banks and set aside, especially she lives in a rural, poor county here in Florida. So a lot of people use their food bank. And I mean, you just gave me a great idea that I will pass along to her because they do that all the time.
Yeah.
But to make it kidney friendly would be a fantastic thing for Kidney Month. And like you said, it's
That
a
is
small
nice.
adaptation.
Yes, small things all add up.
And this
How
is
you
why
do.
we meet, because you just gave me a great idea. I'm going to pass it to my daughter, and she'll make it happen.
Great. That's nice.
Because, yeah, so thank you for that. I appreciate
Yeah,
that,
good.
that thought.
Good.
Well, and thank you all. Thank you all for everything that you've shared here. You know, thank you for answering our questions and helping us to share information with other people. But right now, we're going to look to see if we can get some questions from our audience. If you have a question or comment for the panelists, please put that in chat, and one of our members from the NCC can read those.
Sorry about my cough. It's allergies. It's Florida. It's not COVID. It's just allergies.
I think we can all appreciate having allergies and needing to turn around and go, I promise it's just allergies. So thank you.
Nowadays, if you cough, you get the stink eye. Some people like, what? Like, oh, just allergies.
Again, if you have any questions or comments, if you'd like to put them in the chat box. I know that I saw earlier from some of our people in the audience some comments about some of the challenges that they faced. Some that were agreeing that faith has helped them strong. That came from Charles. O'Neill, I'm going to turn it back over to you in case we have any questions or comments.
Lisa, it's Jerome. We did get a comment about online social networking support groups. I'm wondering if any of the panelists use online support groups during this time over the past year.
I do. I don't know if can you hear me?
Yes, Kim, we can hear you.
Yeah. Yes. I look at on Facebook. There's a dialysis discussion uncensored, and there are a lot of people that talk about very useful information of fellow patients. I find that very interesting. The support group is really a surgical weight loss support group. I still maintain contact with that support group, and there is a hiking group. So we try to still find time within the snow, within we're able to have smaller groups, and we still try to get fresh air and walk, so that's that support, and that way that's very supportive of that group of people.
Anyone else?
Yeah,
I belong to a PKG support group and a Charcot Split support group on Facebook. And again, I use the PKD mostly to share information I get from the NCC. A lot of your links go onto their thing because they ask questions that are just perfect for that. But sometimes it's just nice to hear from people who have exactly what you have and get it. PKD is a little different from kidney failure from other ways. And so they get what I'm talking about. And I think that's always good to have somebody that, can say, hey, I've been there. You'll get through it.
Another question we got from the audience is, did any of the members of the panel use coping strategies that involve using wellness tools like walking, healthy eating, cooking, hobbies, or explore new opportunities? And it sounds like, Donna, that's maybe a question you can answer.
Well, for me right now, I can't walk, so walking is out. But learning a new language has been good for me. Keeps your mind busy. And I'm always for reading. And like I said, I've actually very mindfully chosen to read not just Western authors, but African authors, South American authors. You know, I have to read in translation, but just kind of stretching your mind a little bit and allowing something new to come in. If I could craft, I would be so down with crafting, but been down that road and know that's not successful for me. But anything that just gives you something extra to do and fills your mind, I think is a great idea. If I could walk, now for a little while I could walk, just right now I can't. And when I made it all the way around the block after my surgery, I celebrated. That was a big deal to walk 100 yards. You know, so even just sitting out in the yard and enjoying the birds singing. Kim had mentioned about being out in nature. Just
Yes.
listening to the mockingbirds is just so calming, and I don't know, nature just does something for your soul, I think.
Mm-hmm. I'd like to say something real quick, if you don't mind. Is we started to do this on Saturdays. There's this Winter's Farmers Market in Providence, and we've started to try and make a thing of on Saturday. We plan on trying different vegetables. I don't know. We made this one soup with just different vegetables I didn't try before. I didn't even know what a sunchoke was. We just trying new things with different vegetables and vegetables that we like to use, but just getting out there and making sure we're buying healthy food to work with. And we started to do that, is make sure we go to the Winter Farmers Market on Saturdays.
Well, panelists, Lisa, Shalyn, thank you all for being with us and sharing your experiences. We really appreciate you being with us today. Thank you.
Thank you. And thank you, Kim, for your good idea. Thumbs up. Thumbs
Yeah,
up.
thank you. Likewise.
Thank you,
All right.
everybody.
Thank you.
So before we wrap this up, we want to remind everybody about some online patient and family resources from the ESRD NCC. You can find resources about what to expect as a newly diagnosed patient, understanding the grievance process, choosing transplant, choosing home dialysis, infection prevention, emergency planning, and caregiving. And again, all of these resources were developed with the support of our NPFE-LAN patient subject matter experts. Next slide, please. We also want to tell you about the Kidney Hub. It's our online, safe, mobile-friendly web tool created by the ESRD NCC with, again, help from our kidney patients and their family members. The Kidney Hub has links to important resources, such as the quick start to submitting an emergency grant request. And then there's a video on understanding high kidney donor profile index and increased kidney donor and increased risk kidneys. So all of those resources can be found on thekidneyhub.org. Next slide. Don't forget to follow the ESRD NCC on our social media platforms. Facebook is ESRD NCC. Follow us on Twitter at ESRD NCC and search ESRD NCC on YouTube. So we're going to take about a 5-minute break to transition to our next session. So 5-minute break, and we'll be right back.